Hello there. Welcome to the very first episode of Vartalap with Abhi. Shooting my first episode was one crazy experience. Everybody on my team, including myself, messed up at some point or the other during the shoot. Kya kare yaar? It was our first time. As a virgin YouTuber, I was trying my best not to screw up. But you know who didn't screw up at all? My brilliant guest. Dr. Srikanth from Kids Care Clinic, Tori Chowki, Hyderabad. He is a well-known pediatrician in the city with over 25 years of experience. I have known him ever since I was a little kid. And in all these years, he's treated me, my brother, my cousins, a lot of my relatives for small seasonal flus and some serious ailments as well. In this insightful Vartalap, Dr. Srikanth and I talk about his journey in the medical field, how he got into MBBS, then Masters, how he set up his practice. We also discussed about some important challenges faced by the medical community today, how doctors make money, handle stress, and deal with the pain of losing patients. One of his anecdotes will remind you of a scene from Munna Bhai MBBS. Enjoy. Hello, doctor. A very, very warm welcome.
Thank you, Abhi. Thank you for inviting me for this beautiful show.
Yeah, so you got into Osmania Medical College and 5.5 years of MBBS.
Yes.
Right. So
golden years of my life, I can say.
Call that golden years of your life. So I would like to know everything about your MBBS journey, doctor. So today we, of course, you take the NEET examination to get into an undergraduate medical program. Back then, how did you join the MBBS program?
Those days we used to write MSET to get admission into medical, agriculture, engineering and other veterinary, all these subjects we used to appear for MSET. So first time I got agriculture BSc and that was here in Rajendra, Hyderabad, Acharya N.G. Ranga University those days. And the second time I got veterinary medicine, and third time I thought I want to go into medicine. One of my friend Giridhar, who is 2 years senior to me, so I borrowed his books. He has gone to Gandhi Medical College. So I used to. He also studied 1 year in veterinary sciences. Veterinary. I used to go to him. So I used to stand in front of Usmania Medical College because the bus stop to Agriculture University, Veterinary University was in front of, still it is there in front of Usmania Medical College.
Right.
So when I used to stand and wait for the bus to Agriculture University, I used to see the medical students come with their aprons and I thought I want to study medicine and I should definitely study in Usmania.
Right.
So with the help of my friend Giri and my parents' help and the teachers, third time I got into medicine, Usmania Medical College, luckily. So entering medical college, one more reason why I want to study in Usmania Medical College is, Usmania Medical College is a top medical college in both Telangana and Andhra. So the best students will come. I can learn from them. Right. So I can learn how to study and how to be focused, how to achieve success in your career or your academics. So that motivated me to work hard to get into medicine.
Today there is this culture of ragging where the seniors, they're bullying the juniors, they humiliated, they're insulted, and it has come to a point where a lot of the times juniors have been physically assaulted and they've even committed suicide, so they've died by suicides because of the extreme harassment they've faced as a result of ragging. Did you experience, were you ragged? Did you go through any such experience? And what are your thoughts on how this trend that's going on can be stopped?
So this is not at all healthy and acceptable in civil society. Nowadays we are lucky to have good seniors, good environment in professional colleges. So like they used to ask us to show your talent. Can you sing? Can you dance? Show me. So it was a pleasure to show our talent. It was a pleasure to dance, pleasure to sing, pleasure to act, mime. It is to reward us. They have rewarded us in a college function, after conducting these types of competitions,
Right.
it was a pleasure. There was
So
no
it's more,
ragging.
sounds more like an ice-breaking session
Yes,
and interaction.
exactly.
As opposed to harassment,
Yes,
bullying,
yes,
humiliation.
yes,
So
yes.
these were not
It's not
experiences
at all
that you've-
acceptable. No. There shouldn't be ragging.
Absolutely.
As you said, right, you said ice breaking.
Session. Sure. I also wanted to ask you about your first year. What was your schedule like at Osmania?
So first year we had biochemistry, anatomy and physiology. So anatomy is interesting. Anatomy, first time when you enter the hall, dissection hall, you'll see all the cadavers lying on the tables, dissection tables, all dead human beings. We should thank them. We had a lot of respect for the cadavers, for those lives.
Of course.
Who's,
They're helping
to
you learn.
Yeah,
now.
learn.
Absolutely.
But dissection hall used to be fun, challenging, and competitive because
I
only one body
this
part.
scene from Munaba MBBS where Sanjay Dutt, he enters the anatomy session, he
Yeah.
sees the dead body and he collapses.
Yes, it happened.
Did
It
such
happened
an
many
incident
times.
happen?
Yeah. If, some of our girls used to collapse in the dissection hall.
Right.
So we used to fight because only one body you have to see. You have to divide into upper part, lower part, abdomen, scalp. So one part you have to get dissected by so many people. We used to fight. It's my turn. I have to see the nerve. I have to explore the artery. So it was fun. It was competitive.
Right.
And the formal smell, initially it was tough to bear that smell because the body used to be they're immersed in the formalin, no? Formalin
Right.
tanks. From formalin tanks you get the bodies out and
Very pungent,
very
strong
pungent
smell.
strong smell. So after a few days we used to get acclimatized, used to that smell and that environment, color. And when you go to hostel, when you go to diary room, that smell used to carry with us. Even if you eat, you'll smell that
Formalin.
cadaver and formalin smell. Anatomy was good because you see and you see the body part, you explore the body parts, you find some now, some rare now, and the teachers used to appreciate. Oh, good, you have got this now identified, this artery identified. So it was good. And another subject is biochemistry. Biochemistry, we used to go to lab. We used to have first half is morning session is used to have practicals like your dissection or your biochemistry lab or your physiology lab. Physiology lab is another interesting thing you used to do. I mean, it's what you call used to dissect frogs. I mean, now human rights and all this, but it's sad. But to save human race, we have to sacrifice few animals like frogs. We used to study.
Is it no longer allowed?
I don't think so now. I don't think so. They are doing nowadays. So because the system has changed. So we used to do all the systems like your nerve system. We used to do gastrointestinal, cardiac, and plants also we used to do. So physiology is an interesting one. We used to do practicals, and biochemistry. You see the colors. You experiment with the urine. You do a lot of tests.
Right.
So first half is practicals, and second half after your lunch you will have theory classes.
Theoretical
classes. Theory classes, though we had good teachers. I mean, those days I'm not sure we were very attentive in the class because after morning practicals we used to sleep on the bench.
Right, and that too after a
some
nice
proxies. Yeah. Post lunch stupor will be there. Few teachers were teachers in interesting way. All teachers were good, but few are monotonous classes. But we used to finish off those theory classes by 4 o'clock. Our curriculum those days was 4.5 years of study, examination and classes. 1 year internship.
Right.
Compared to present system, which is 5 years, that is 4+1.
Okay.
So second year, second MBBS we had 18 months, but now they have made it to 12 months.
Okay.
So 4 years, 12 months, 12 months, 12 months, 4 years now. But we used to have 4.5 years academics.
Okay.
So 5.5 years for us, now 1.5 year.
Okay.
So now they are starting seeing patients from day one, from first year onwards. our days we used to see the patients after you clear your anatomy physiology. That is after 1.5 year of your MBBS only you used to enter the hospital, see the patients.
Right.
So there is a change. It's a good now actually they are integrating subjects. Say anatomy, you see the only cadaver. Now they are integrating with surgery. So when you see a nerve or a part, liver or your appendix in a textbook, and when you go to hospital, you'll see the live patient with the appendicitis or with a wound or with a cut or with a hernia. So you know what is hernia in anatomy, but you don't used to see the patient. Now in this generation, now the new curriculum will give an opportunity to see a patient with hernia, see a patient with appendix. So this integrated system is good.
Wonderful.
So that we didn't had those days. Now this generation has got the opportunity of virtual learning. Not only virtual learning, what you call mannequin based. So if you want to intubate a patient, so you might not be good at intubation. You might trouble the patient. You might be failed in intubation. Intubation is putting an air pipe, artificial pipe into the airways to give him oxygen, to ventilate his lungs.
Sure.
So now they have mannequins, they have models to intubate, to operate, to suture, to put a central line. All these are there now for the new medicos, which is good. So the chance of error is less if you practice well on the mannequins. We didn't had those gadgets those days.
So that's a good advancement that is
Good
taken
advancement,
place,
yeah.
and it is
and integration of the
helping them learn
subjects.
better.
Integration of subjects.
Integration of subjects.
Yes.
Right. Which you didn't have back
No.
back in the day.
We saw the patients when we entered.
Much later.
Yeah, much later.
Right. Coming to this question, doctor, about your system of assessments. How often did you have tests or assessments?
Yes.
And so, like in first year, how often did you have your tests? Practical, theoretical? What was the mode of assessment? Were you supposed to write long essays, or did you have short answer questions? Was it multiple choice based questions? How were you assessed?
So the main assessment is like your public exam, which is conducted by the NTR University of Health Sciences, which is a governing body of all medicals in the Andhra Pradesh, United Andhra Pradesh. After first year, you'll write biochemistry. 1.5 year, you'll write anatomy, physiology. Then after 1 year, microbiology, pharmacology. Again after 1 year, your pathology, forensic. And after 1 year, you'll have ophthalmology, ENT, SPM. Then your medicine, surgery, gynecology. So, and there again, pediatrics, orthopedics, histology, embryology, all these. So, main assessment is yearly once or 6 months later. But in between, we used to have your tests. Those are all practical, to practice, to do better in your exam. They used to have tests, pre-finals we used to have, and we used to have theory from day one, from first year onwards, and practicals. So both, you have to pass in the both subjects. So that was our system. If you fail in first year, you have to repeat. You will get the chance after. And first hurdle is anatomy physiology. If you stumble at that point, you lose 1 year. You'll be joined with your juniors, 1 year juniors.
Right.
So that was very tough. So most of the casualties happens in your first year, anatomy physiology, which were very considered to be very tough subjects.
Okay.
So once you clear that, again till final year there'll not be any obstacles. So first 1.5 year was very tough for a medical students, because if you miss the subject, you're gone. You're 1 year behind.
Right.
So after first 1.5 year, after you clear your anatomy physiology, you used to enter hospital. You see the patients. That was a big challenge. You will have an apron, and you will have a stethoscope around you'll feel like a doctor.
Wow.
So you
That's the high.
The
That's
patients
the big
will
high.
think you're a doctor, though you're not
Still a
doctor.
student.
You address as you're a doctor. So it was happy feeling and
That's a great feeling.
yeah, great
right?
feeling. It's like seeing patients.
It's like a dream.
Yes.
Dreams come true because you
Yes.
have your white apron on.
Yes, yes,
You
yes.
have your stethoscope and
Yes.
people addressing you as a doctor.
Yes, yes.
Much brings you much closer to your
Yes,
dream.
yes, yes.
So this is after you clear
Anatomy, physiology.
anatomy and
Biochemistry,
physiology.
physiology. After 3 subjects, 1.5 year, you'll see the patients.
Right.
You'll be in the wards.
Right. And what is the second year like?
Second year, like theory, microbiology, pharmacology, and then pathology, forensic. So when you start hospital ward rounds, Usmania has got the luxury or
The advantage.
of so many hospitals.
Right.
We used to have a bus, college bus, so they'll allot postings to you. So this month ophthalmology, this month ENT, in the next month you have to go to fever hospital, like that. We used to have a bus. The bus used to carry us, ferry us to and fro from those hospitals. Morning we used to go to hospitals, come back and study this microbiology, pharmacology, and then pathology, forensic. That continues till you pass out from Usmania, like you finish your final year MBBS. So till that time we see patients. The professor comes first. Before professor comes, the intern write the notes. Interns who are posted there. Then PG sees and he sees the changes in the patient. If you want to add some medicine or stop some medicine, he will write. And then assistant professor comes. Then assistant professor comes. Then professor comes. So it is a grand rounds.
Okay.
So it was a good academic feast. So all the best brains in the state, because they are all good,
Right.
great teachers.
Very
so there were no
accomplished.
private hospitals those days.
Right.
All the best knowledge used to be in government hospitals. So now all the best teachers have gone to corporate sector for so many reasons.
Of course.
For their professional satisfaction, for their progress in the field. So those academic rounds were very good. I mean, every detail they used to discuss about the patient, illness, the signs, symptoms. It was very good. So
It's a
you
great
learn
learning.
by listening to them.
Right.
Most of the learning, you'll see and you'll retain the subject rather than looking at the books and trying to rot those subjects or
Right.
signs and
Memorize
symptoms.
the-
Memorize. You have got the opportunity
It's a
to
more practical experience.
Yes, you'll see, you'll retain. Post that we used to come to college. After lunch, we used to have subjects. They used to have classes.
Right.
We used to listen. We used to sleep sometimes in the classroom. We used to throw rackets on our friends. We used to boo the teachers sometimes. They were very kind to take it in a sporty way.
Right.
So all these were there.
And that's so these classes would go on till the afternoon?
Yes. Afternoon.
Afternoon.
And theory classes till 4 o'clock.
Till 4 o'clock
Yeah,
in the
yeah.
afternoon.
And
Post-
college, hospital also, when you enter final year, we used to sit in the OPs also. I was talking about the bedside rounds in the
Right.
wards.
Right.
We used to have OPs also, all the subjects, dermatology, ophthalmology, psychiatry. We used to sit in the OPs with the final year. We used to sit with the PGs. We used to learn there also. Sometimes the PGs used to teach us, ask us to find out what is abnormal in that patient. So OPs also were there in the morning. Wards and OPs, those used to cover.
So, doctor, you've spoken about the advantages, like such an established institution like Osmania University. You had access to great hospitals, a lot of practical learning that happened, amazing professors, good friends, great infrastructure. What were some of the challenges that you faced during your MBBS program? One, of course, you mentioned was the language barrier from Telugu medium to English medium, and you had to learn to become more fluent in English, and you had to work on that. What are some of the other challenges that you faced, and how did you overcome those challenges?
So I had challenges like all my friends, like it's a vast subject,
Right.
and some subjects are very dry and you don't easily understand the subjects.
Right.
So these are all challenges, retaining them and reproducing them. And but I had a separate challenge.
Which was?
That is my handwriting, which was and is still very bad. So one day during my practical exam for physiology, or my professor, so she put my papers, my theory exam papers in front of me,
Okay.
and asked me to read an answer from my note, from my answer sheet.
Okay.
So
Read your answers out loud.
I couldn't read my own, though I did my exam very well.
Right.
So that was very tough by my process to read. So I learnt a technique to overcome this problem of my handwriting
Sure.
by giving space and taking lot of supplementary sheets, additional sheets,
Right.
spacing them between the words, between the sentences, and highlighting the important points in colorful, with colorful sketches.
Right.
So I that challenge is still haunting me. That I would call handicap. My handwriting is not good. That's the biggest challenge. I am not able to overcome how to.
But this is what is said about doctors, right? That
Yeah.
doctors usually have a bad handwriting.
Yes,
Do you
yes.
think that's true? Doctors usually have a bad handwriting?
No,
Or-
not many. Yeah, probably few of the doctors. Like,
So that's a myth.
like yeah,
Not
that's a
all
myth.
doctors
No,
have
no,
bad
no, no,
handwriting.
No, no.
Right. Okay. So the handwriting was an issue,
Yes,
and
yes,
you
yes.
overcame that.
Yeah, yeah.
You mentioned the importance of having a good college, going to a well-established institution where there is access to good infrastructure, skilled professionals, teachers and educators. You have access to a hospital where you can meet and interact patients. Would you say that is that today that there's so many hospitals, so many medical institutions have come up? In general, do you think that we have good colleges, good infrastructure, and that students have access to all of this that you had back in the day?
Yeah, sadly, it's not a healthy environment now.
It's
In
not.
a medical student's perspective, because lot of the government has decided to start more medical colleges to meet the WHO norm. Say every 1,000 people they need to be one doctor.
Okay.
So, but to meet now we have around 1,500 one doctor for every 1,500 population.
Okay.
So to meet that, to fill the gap, they are going on increasing new medical colleges without infrastructure, without teaching staff, without patients. So the learning will take a beating if you don't provide infrastructure, if you don't recruit teaching staff or other supporting staff, not only teaching staff.
Right.
The norms are not get fulfilled. What they are doing is they are showing on paper to get recognition for a medical college, but practically there are no teachers, no patients. So they on an inspection day they bring patients to fill the wards, show that yes we have so many beds occupied, we are taking so many patients. They cook up stories that they write false case sheets. All these are happening, which is not good. So the government has to be strict, vigilant to counter these malpractices, to help the medical student learn, get the good knowledge, get exposed to the proper teaching, proper clinical material, so that he will serve the nation well. So incompetent doctors will be produced with this present system of expanding colleges, bringing new colleges, new medical colleges, increasing medical seats. There is no point in bringing out doctors who are not competent enough to save patients, save lives, save the nation.
Absolutely.
So that has to be curtailed and stopped.
Right. So the quality of education has gone down.
Yes,
Medical education has
definitely.
gone down
Yeah.
because, like you said, lack of infrastructure, lack of
Clinical material and teaching
clinical and
material.
teaching material. So that has significantly affected
Yes,
the quality
yes.
of education, and I think this is something that government concerned authorities
Yes, yes.
should
Look
take
into.
notice of and look
Yes,
into.
yes.
Are you aware of such cases that have happened where these things have come to light, where the college doesn't have infrastructure, they're not well equipped, or that there are no patients, and all of these incidents? Are you personally aware of such incidents? that have
We
happened?
see that situation in private colleges as well as government hospitals also.
Really?
Yes, because new college the recruitment of doctors is not there. Then how you can start a new college? When you recruit enough staff, then only you can run a medical college and then you can teach students.
Absolutely.
Then it's happening both in government and
In private
sector.
colleges
Yeah.
as well. Right. This is something that
Yes.
needs to be addressed.
Yes.
Can you tell us a little bit about your internship? Where did you do your internship? What was that experience like? And tell us a little bit about that.
So internship is like Usmania has got many affiliated hospitals. So on internship is like medicine you work for a few months, surgery you work for a few months, orthopedic you work in the wards, like you have practical experiences, you do suturing, you do operate, you do help the surgeon, you do deliveries. The most happiest thing is delivering babies. We delivered so many babies.
Wow.
So we are posted in a Sarojini hospital treating eye problems, ENT hospital, Nilofer. So internship is spread across all the hospitals. So it's a 12 months internship. Every month we'll change the hospitals. So 1 month is community medicine. You see what's happening in community, what are the government, central government programs. So what is your malaria eradication, how to prevent waterborne disease, what is leprosy, how to prevent leprosy. All these we learn in community medicine, and the major subjects, all the hospitals we got a chance to work in Hyderabad during internship. And we used to get some money. That was a big thing. And my first income, I bought a sari for my mother. So probably that was around 1800 rupees per month per work we did in
back then.
Yes.
Right. 5 years of MBBS. How much did it cost you back then? Can you tell us? 5 years.
So probably around 12,000 rupees for my entire medicine.
Really?
I spent. Yes.
Okay, and this was which year, doctor?
92.
92. So you spent 12,000 rupees
Roughly,
on around 12,000 rupees on 5 years time.
Yes.
But today it's a completely different story. It has become extremely very, very expensive, and particularly in private colleges. If we compare, the fees is exorbitantly high. Getting a
it varies from 60,000 to 25 lakhs per year.
Per annum. So why is it so expensive?
Yeah, private colleges charge more to impart medical education for a few reasons. One is there are norms to start a medical college. Say you should have 25 acres of land. You should have these many buildings, this much square feet of constructed area. So you should have these many beds to start a medical college. Say 200 beds, each department so many beds, and you should have these many teaching staff, these many tutors, registrars, assistant professors, and you need to have so many nursing staff, lab technicians, and office workers. So much investment the medical college owner should spend to start a medical college. And they have to give free service for OP. They have to treat free of cost. So, and they have to charge very minimal for the inpatient charges, patients. So, this will put a lot of burden on the medical college management. So, it's a business. They are not doing this for charity. They are not. They are a businessmen.
Of course.
So, for
that,
that,
big investment for them.
Yeah. So, for that reason, they charge certain amount, which is determined and decided by the government only. They don't have the liberty to increase the fee. Government has clearly categorized how much you charge for A category, how much you should charge for B category, how much you charge for C category. So the reason is this one. So it's very sad. Everyone can't afford, and they have to take loans, and sometimes they don't get loans also. In that process, what people are doing is compared to here. In other countries like China, Philippines, Ukraine, Russia, Belarus, Georgia. So those countries offer medical education at nominal cost. So they go there, but unfortunate thing is that system is different. The teaching probably is not on par with our medical teaching here in India. So there is a language problem. So patients will not be cooperative like our patients, current patients. So they come here at formal at clearing the foreign medical graduate examination. They have to clear an exam called FMG here. So around 10-20% of foreign medical graduates only will clear the exam to practice medicine here, to appear for post-graduation exam here. So it's unfortunate. So how to prevent that outflow? Letting our children to go abroad and study, who are not competent enough to practice here to clear the exam. What we can do is the government can minimize the requirements without compromising the quality of teaching, quality of service to the patients. They can minimize. Say instead of 25 acres, you can cut down on the land you need.
Right.
And you can minimize the infrastructure area.
Sure.
So many buildings. You can go vertically rather than
going horizontally.
Yeah, horizontally.
Right.
So that can reduce, and using government hospitals. So say every district we have a hospital. Anyway, government has started medical college in every district, but we have private hospitals. So instead of starting a new medical college, some hospitals are there. Say 100-bedded hospitals are so many. So 100-bedded hospital also will be enough to teach medical students now, because with the technology should be used to utilize these hospitals, private hospitals, to start a medical college.
Right.
So that the investment of the management will be less, so that he will charge less for the medical student, aspiring medical students.
Right.
So that's the reason, that's a way to cut down the cost of the medical education.
Right. So come up with cost-cutting measures.
Yes.
Right?
Without compromising the quality of
compromising
education and
quality of
compromising the service we offer to the patients. It's possible. The government should think about it.
And I think that can make a big difference.
Yes, absolutely.
Less pressure on the management.
Yes.
They will charge less.
Yes.
The fees will come down.
Yes.
And it will become more affordable.
Yeah.
And
Because in 100-bed hospital, you have doctors, you have staff.
Correct.
You have patients.
Of course.
There's a ready-made building.
True.
So those can be utilized.
Right.
Yeah.
How is specialization different from the MBBS program? Can you throw some light on that, doctor?
So I did my PG in Nilafar,
Right.
DCH. It was 2 years course. So like
One of the best hospitals.
Yeah,
as you
one of the
mentioned.
best hospitals and the only pediatric hospital in the state. So usually we have OP in the mornings, and after we finish 9 to 11 we have 9 to 12 we have OP. So after that we'll go to wards. So and we admit some cases. So we write notes for the admitted patients. And weekly once we used to get duty. So that is 24 hours duty, and where we have emergency room. We see emergency patients. Few of them needs admission. There's an emergency ward where we admit and treat them. And some patients can be treated and written prescription and send them home. So that is your ER, what we do in ER.
Right.
ER inpatients, some cases used to be very sick, like we used to see encephalitis, that is brain fever cases. We used to see cases with fits, that is seizures. We used to see pneumonia cases. We used to see poison cases, the kerosene poison and organophosphorus poisoning. So it used to be a challenging work, working in emergency ward. That is general pediatric emergency.
Right.
And when you don't have 24 hours duty, we used to work in the wards. When you don't have OP, weekly once OP. Rest of the 5 days, you used to be in ward. There are semi-emergency, not so critical, we used to keep in wards. So wards we used to make rounds, make notes, order investigations, draw bloods. We used to draw the blood from the patient. We used to do lumbar punctures. We used to do some basic procedures. We used to present our cases to the interesting cases. Our examination pattern is like your CNS, central nervous system, cardiovascular system, respiratory system. These are 3 broad systems, and hematology, hematopoietic system. So these are broad topics. When we see a good case, we used to prepare notes, present to our process. There used to be good discussion at the wards. When we were undergraduate student, we used to listen and watch.
Right.
Now it's our turn to present. To come to a diagnosis. So first we used to present symptoms, differential diagnosis. These are the possibilities. So out of these 4 possibilities, this could be the first possibility. Why this is first possibility? Because these are the findings in favor of the first possibility. What do? I order these tests to confirm this diagnosis. How do you treat? So these are my options for treatment. These are the methods to follow up. These are the chance of his survival. These are the chance of his poor progress. Like that, we used to have good ward rounds.
Right.
And every month every Thursday we used to have a clinical meeting. Clinical meeting is bedside round is only our unit. We used to allot units. I used to be in, say, unit 1. I used to see unit 1 cases and used to present in my unit 1 processor. But weekly clinical meeting is all the from all wards we used to club good cases, interesting cases, rare cases, and we used to discuss in the seminar room. And sometimes our cases used to be presented in journals. So I had got an opportunity to publish an article in journal with my professor.
Okay.
So like that is used to a good learning experience in general pediatrics, and we used to work in NICU, neonatal intensive care. That is much more satisfying and give us pleasure and help saving newborn
Newborn.
with immature lungs, immature brains, immature gut.
Right.
So, and sometimes because those days the medical technology and knowledge was not
as
advanced. So
as
we
it
used
is
to lose
today.
many babies with the infections and immature lungs. And we used to learn how to ventilate, how to treat jaundice babies, how to do transfusions, exchange transfusion, what you call severe jaundice. We used to do blood exchange. So that was very challenging and very satisfying. And we used to work in pediatric surgery wards. We used to go into the theater to see the surgeries operated on newborn babies, intestines, stomach and brain. All these were we learnt. And when we cleared my DCH, and after that I did my DNB from Mahavir. And Mahavir, there were no stipend, only 2,000 rupees I used to get while studying my DNB. So I used to work in a private hospital where I was left with a ventilated baby on the first day.
Wow. Okay.
So it was a big challenge. In Nilafar, we didn't have ventilators to learn.
Right.
So there I used to learn what is how much oxygen you need to give, how much pressure you need to give. I used to take help of my seniors. It was a good learning experience, and we used to save a lot of babies. And used to learn the advanced techniques in private hospital, corporate hospital, and used to use those techniques in Mahavir Hospital, which is not that much advanced. It was a charitable hospital. It was a poor man's corporate hospital.
Right.
So like that, it was a good PG training for me at government sector and a an NGO setup and a corporate sector. I worked in 3 setups, so which helped me evolve as a good pediatrician, which gave me a lot of confidence.
Right.
So it helped me pave a way for my individual practice, because I was equipped with knowledge, experience and confidence. So these 3 helped me to become a good pediatrician with the help of my teachers and my poor little patients.
Right. My next question would be, the other day I was doing some research, and I came across this information that, of course, mental health issues are on the rise everywhere. But particularly in the medical community, I was reading this article. The National Task Force on Mental Health and Well-being did a survey of medical students in 2024. It was an online survey, a nationwide online survey, and they came out with a report, and it was really shocking to see that about 28% of undergraduate medical students and about 15% of PG students, they have been diagnosed with a mental health disorder, and a percentage of them have even reported having suicidal ideations. And this I found really shocking, that it is happening in the medical community. Some of the reasons that were cited were extreme work pressure, continuous and long working hours, inadequate infrastructure and lack of proper support. So my question to you is, do you believe that the medical community today is grappling with a mental health crisis? Do you think that's happening?
Yeah.
Was it the case back in the day when you were studying PG and when you were a UG student? Were mental health issues as prevalent as they are today? And today, is it a serious problem? What's your...
So mental health is a problem, is a global problem.
Right.
It's not just confined to
The medical
medical fraternity.
community.
It's seen everywhere.
Right.
So many factors, like your aspirations, your ambitions, so the challenges, all these will are contributing to this problem of epidemic of mental health issue.
Right.
So when it comes to the medical fraternity, it's much more because especially postgraduate, if you take postgraduates. So postgraduate sometimes has to work for 36 hours non-stop. So when we have a regulation for a pilot when he's flying a flight.
Right.
So his working hours are limited to 6 hours or 8 hours or 10 hours
Sure.
to safeguard his patients. So his passengers.
Passengers, absolutely.
So when there are regulations for other professions, if you take other fields like your 8 hours
Right,
in a
of
day,
course.
you have to work.
Yes.
So isn't it inhuman to make a postgraduate or intern to work for 30 hours?
Absolutely.
So it's not only
inhuman to do that.
yeah,
actually.
it's not only putting the intern or the postgraduate health at risk, but also you are risking the
Lives of the patients.
life of the patients.
Right.
Because how can you expect a person to work for 24, 40, 36 hours?
Right.
So prolonged working hours, and you have not only treating patients, you have to write the notes, you have to draw the bloods, you have to go to the lab, get the reports done, and coordinate with all the systems and deliver to save the patient. So it's very challenging. So the solution probably is improve the infrastructure, hiring more staff to do all this, to say why the PG needs to draw blood, why don't you appoint a phlebotomist or a lab technician to do that job?
Right.
Why you can't make digitalized system in government hospitals so that the PG, while doing his clinical job, to see the reports and get the reports online?
Right.
Why don't you use technology? Why don't you use the technology to lessen the burden of the doctor who is working there?
Right.
So why don't you increase the number of PG seats?
Sure.
Why don't you utilize the district hospital to hire more, increase more PG seats so that you get enough hands to serve the patients.
Right.
So all this can be done to lessen the burden of the mental burden
on the doctor,
intern or postgraduates.
the postgraduate.
So and the staff also, the doctors also. So doctors also, the bosses.
Right.
The bosses should be compassionate with their students.
Absolutely.
So they are your junior colleagues. They are not your subordinates. Or don't treat them as a subordinate to you or lesser human being. Right. So he, after his completion of his postgraduate, he will be sitting next to you as an assistant professor. So treat him well. Absolutely. So everybody should change. The government should change. The policy should change. So the patients also should understand that sometimes they are very demanding. Increased demand from the patients also. The helping attendants also is putting burden on the doctor. They should understand that doctor is a human being. He is trying his best to help you. She is trying her best to help you. So don't put him in must disadvantage position by putting all your demands on the doctor.
Another thing that I wanted to speak to you about is the cases of the rise of violence against doctors that we've seen, especially in this decade. It is extremely serious. Wouldn't you agree, doctor, that there's so many cases where, every other day on Instagram you see a reel where the doctors are, beaten up, they're thrashed, and there's so much discussion today, of course, about safety of doctors, because the kind of treatment, the kind of violence that they're facing. So why do you think there is so much violence today, and why has it risen? What is the cause behind it?
So apart from the work pressure on the doctors, there are three other issues which are leading to this. So money, misinformation and media. So these three probably are playing a role in my opinion.
Okay.
So apart from the stressful environment where doctors can't deliver their best in the interest of the patient, so that probably contribute to the mishaps. And money. Healthcare is now in the hands of the private sector. So government is not able to cater, especially these things happen when the patient is really sick and ill, terminally. So when patient is not getting free of cost treatment, when the patient is going to a private hospital, where they need to sell sometimes their hard-earned monies they have to spend, and sometimes they have to sell their properties also to pay the bills. When the attendants are pinched with the financial burden of getting their kin and kith treated, they will have definitely antipathy towards the hospital, towards the staff. They think that they are charging more exorbitantly, or they are looting the families.
Right.
But actually, private sector is they are for profit. They are not here to do free
It's
of
not a
cost.
charity.
They incur, because if you start a hospital, you have to. They are not,
There are expenses to
there are
incur, of
expenses.
course.
There are expenses.
Of
They have
course.
to pay the double the cost of the electricity bill. They have to pay the double the cost of the, not double, the 3 times 4 times more as a commercial establishment. It's a commercial establishment.
It is a commercial
The government is charging them as a commercial establishment.
Right.
They charge more on the electricity. They charge more for the water they use. So they have to hire the best doctor. They have to hire the buy the costly equipment to save the patients.
True.
So in that process, the bills will be more. When the patient's family is paying from their pocket, because there is no insurance, only 10-20% people are having insurance.
In this country.
Yeah,
True.
very few. And they are not going to hospital, government hospital, because of lack of infrastructure, lack of facility in the government sector. They are coming to private hospitals. So where they spend their money, when the end results are not good, then they'll have a type of aggression or antipathy toward doctors. Especially, patients comes with the hope that every patient, their beloved ones will be saved.
Cured or treated, right.
Because doctors are not gods, hospitals are not temples to save everyone.
Right.
So there are terminal illnesses where we can't, in spite of putting our best efforts, we can't save the patients.
Of course.
Because disease is not a complete a problem. The patient also, when the patient is immunocompromised, patient has got severe infections, patient has come late to the hospitals, so there is a chance of untoward incident, that is death happen
Right.
to the patient.
Right.
So we don't want to happen it, but unfortunately sometimes we have to accept it. But patient will not understand that sometimes.
Right.
So when their dear loved ones are no more, they show their aggressions, emotions, which they try to exhibit on the doctors, and they attack the properties and the doctors who are working in the hospitals.
Right.
So one is paying from their pocket. Second is they think that everything can be cured by going to the doctor, which is not true. And the media, what my media is saying is, sometimes media plays a role by showing doctors in bad light. So there might be black sheeps in the healthcare, as you see in every sector.
Right.
So media sometimes write so patient is died because of the negligence. At the bottom they write the doctor has collected, there is no fault from his side. They have done the best. They will not write that. They will write the headline as patients were killed in this hospital. Patient died because of the negligence.
Right.
So it might not be true. So that will send a wrong message to the community. So doctors are taking money, but they are not doing good for the patients.
Right.
So this is a problem. So doctors are not gods. They can't save every life in spite of their best knowledge and efforts. So, and patients should understand that the burden of treating patients is not on the private sector or the individual doctor. It's on the system.
Right.
So the people should understand. So actually we are not using, the community should, the nation should understand that providing healthcare is the responsibility of the government.
Right.
So when there were 2 hospitals, when the population was probably 50 lakhs in United Andhra Pradesh or 1 crore in the United Andhra Pradesh, now we have probably 7 crores. How many hospitals have come up in Hyderabad? Only Gandhi and Usmania were there, still there, the 2 hospitals. Nilofar Hospital was established way back in 1950s, but still only 1 Nilofar. Why we are not asking our rulers to start more hospitals?
More government hospitals.
Yes, why not? When the population has gone to 4 folds or 5 folds, why only still the same number of hospitals should be there? Why don't the people demand the government, their elected representatives to start more hospitals, to improve them, to invest them in them, improve the infrastructure?
Sure.
If it happens, the patient will not lose money,
True.
So that should be the change in the thinking of the community also.
Right.
And government should give priority for the health and education.
Of course.
When your budget is not allocated to health, how will you improve? How will you serve poor patients? How will you serve the middle class? They have to spend money on the healthcare from their savings by taking loans, by selling the properties.
Absolutely.
So it has to be change in every section of the society,
Every
aspect of
aspect.
society.
And government.
Media, government, public, everything. Doctors also, we also should change. We also should treat patients as a not as a commodity, as a money earning object. So few might think in that way. We also should change. We also should be empathetic to towards our patients.
Certainly.
So everyone should change.
Absolutely. And I think you brought up a very beautiful point that, it's more deep rooted, and I think they're different. It's not just one issue. There are multiple issues that
Yes.
need to be addressed. And of course, when it comes to the government, we need more government hospitals. They should work on building better medical infrastructure in
Yes.
the country. And the point that not enough is being allocated, that the health care needs more investment. The government needs to allocate more budget
Yes.
for health care. I think that's
But
a
we're
very
not
valid
asking.
point.
We're not asking the government to invest.
Invest
which is
more
right.
in health care, of
Yeah.
course. I think that is, I think from doctor side, better communication,
Yes.
reaching out.
Yes.
And
Too empathetic. Yeah, that we should learn that. Probably, I'm happy with the new curriculum which teaches the young medicos how to be empathetic, how to communicate with patients. That's also very important.
bedside manners and
Yes, yes, yes.
communication.
Very important. Yeah.
Can you tell us when did you start? In which year did you start your practice? And where did you work?
Starting your own practice, you need money.
Yes.
And first of all, you have to locate a place, ideal place to
Start your practice, absolutely.
So while doing my PG, I used to visit hospitals in Medipatnam area. So after completion of my post-graduation DNB, I thought, yes, this is the right place to start.
Your
For
practice.
that I have searched, to start my practice, I have decided to start in this area. So I looked for many places, but I couldn't find. Finally, I got a place. But the owner of the place is not confident about me.
Okay.
So I don't have money. So he thought that this boy, whether he would be able to pay the rent or not.
Okay.
So he didn't give, he didn't budge. It took a lot of time to convince him that, sir, I will pay your rent. I will not run away. Because I don't have any other source of income.
Right.
The rent was 4,000 per month. So
Back in
2004.
2004.
So he needs, I need to pay some deposit also to get that accommodation, that
Correct.
place. So my father was retired at the time. He gave me 1 lakh rupees, out of which 75,000 I gave as deposit. Rest of the 25,000 I used for the
Setting up
developing that place into a clinic. So to buy a bed, a table, a weighing machine, a stethoscope, few chairs to make the patient sit.
Right.
So finally I could convince the owner, and he gave me the property and started 2004. And initial 1 year, 1-2 years, I really worked really hard. So I used to visit nearby hospitals, see the patient. Middle of the night they make a call, attend the delivery. There's a sick patient, there's a patient child with seizures. I used to wake up in the middle of the night, early morning, whatever the time it is.
Right.
I used to go to the hospital. My phone was on 24 hours. Patient used to call me. I did work really hard. And I used to run my OP, and I used to go to Old City also, Ziaguda,
Okay.
where I used to practice from 9 to 11.
Okay.
And I used to skip all the functions I couldn't attend because I had to
You had no
be
personal
available.
life.
I used to miss all the family functions and friends functions.
Right. So now I want to ask you about some of the most challenging cases. Do you remember some of the challenging cases that you worked on? And what was that experience like? What did you learn from that experience? Can you share?
So a couple of cases I can recollect. The child was crying continuously. A girl.
How old was she?
She was around 2 years, 3 years.
Okay.
So I couldn't examine her to find out why she's crying. Okay. So I tried my best to examine her, but she's not allowing because she was completely in some pain. She's crying.
Right.
So what I did is I took an extreme step of pacifying her with a slight sedative. So sedation sometimes can go wrong. Sometimes sedation can suppress your respirations. It will make you, it can make you having difficulty in breathing. So that child was having trouble, as I feared, because I should find out the cause to treat her.
Absolutely.
So that child had tough in breathing, but as soon as I noticed that, I gave oxygen to her, took her in my car and rushed to a hospital where I could stabilize with the help of the equipment, the oxygen, the nebulization.
Right.
So I could help her with a lot of effort, and I'm happy, but they're happy. They'd still come to me after 20 years, 25 years.
Oh wow.
And second case was a newborn with the baby was not feeding on second day. When I examined that, I suspected the baby is having some brain infection. When I took the fluid, brain fluid from the back by puncturing her back, it's a small setup.
Right.
I saw frank pus in the fluid, brain fluid, cerebrospinal fluid, what you call.
Right.
So I started on antibiotics.
And we're
Actually,
talking about a two
day old baby.
Wow.
So brain infection, frank pus in the brain can kill the child. But I treated the child. I have treated the child in a small setup where I don't have backup. The nursing staff was not so knowledgeable in pediatric care. I don't have duty doctors there who know the pediatrics. But I took the challenge and I saved the child. The child is now probably around 22 years. Now my practice improved with those
experiences.
Experiences in my
Wonderful.
So I was happy with those experiences. Though it was they were tough and tiring, but I was very happy and gratifying. So saving life and seeing smiles on the faces of the children.
And seeing them grow up now.
Yes,
and
yes.
doing so
So
well.
now I am seeing second generation. Those kids who have treated by me, they are coming with their children now.
Oh, wonderful.
So it's fulfilling. The profession is fulfilling.
Wonderful. Doctor, I want to know, dealing with death is very difficult.
Yes.
Losing a patient is, of course, very difficult for a doctor. Yes. Especially, it's even more difficult when it is an infant or a young child.
Yes.
Do you remember the time when you lost your first patient?
Yes.
And what was that experience like?
So I do have a bad memory about a patient. Two memories I can share with you. So one is during my initial practice, a 6-month-old child has come to me, fever. So fever was very high grade. I gave medicines. Usually first day of fever, usually will not start antibiotics. Meningococcal infection is a very severe disease which can kill you in no time because the infection spreads, especially when it affects the infants. So under 5 children, it's very common. So that child had, and we didn't had the vaccination at the time. Now we have meningococcal vaccine which can be used for though it's costly, we still recommend to our parents to use that vaccine because it don't give time. Unfortunately, we lost that child. So because of the age of the child and the severity of the disease and lack of vaccination. And second child is a child Suhas. We lost him last couple of months ago, say 6 months ago. The child had muscular dystrophy. So muscular dystrophy is a congenital condition where your muscles are not strong enough to make you stand, walk, to do your activity. Slowly it will progress. It will impair your lungs. It will impair your heart. So unfortunately, we lost a child even after. There is no cure for the disease. We know that the child is going to die. So even though you know that it's a big trauma and sad feeling when you lose a patient. So these two children I remember.
Doctor, as a pediatrician, I want you to talk about some of the common reasons or the common ailments or health conditions which are on the rise, for which patients come to you for treatment. And if you can talk about the underlying causes and what can be done to treat them or prevent them.
Yeah. So we have 2 types of diseases. Communicable disease, which are spreadable, which spreads from person to person. Non-communicable disease.
Right.
In children, we have both. So coming to the communicable disease, which are infective in nature, they spread through water, food, air, and vectors like your mosquitoes, your flies, all these.
Right.
So especially during monsoons, all the doctors will be busy.
Right.
So because we have all the three at a time in these 3 months. So rest of the year also they'll have, but more number of cases we'll see in these 3 months, July, August, September.
Right.
So we have mosquito-borne diseases like dengue, which is fatal, but is also preventable. If you take sanitary measures, if you keep your surroundings clean, that is preventable. Use mosquito nets, mosquito repellents, dengue is preventable.
Right.
And this is treatable if you diagnose on time, if you don't miss the danger signs.
Right.
So losing a life with dengue is a blot on the society. One is you didn't prevent it to happen and you didn't treat appropriately.
Right.
So it's sad. No one should die with dengue. So another is chikungunya. Chikungunya also is preventable. It's mosquito-borne disease. So chikungunya is not a life-threatening disease, but it's a debilitating disease. It makes you suffer for weeks and months together, and you will lose your productivity. So you use your valuable time, resources. So fighting this. That also why it should happen is a modern society.
Absolutely.
So third is airborne. Second is airborne. One is mosquito-borne. Second is airborne. Airborne is like your flu, your pneumonia. These can be prevented because vaccines are there to prevent flu, to prevent pneumonia. So and hand washing, taking healthy diet, staying away from crowds. So using masks when you go out in a unhealthy environment. So these are preventable. That can be prevented.
Sure.
And waterborne, take boiled water, avoid taking outside food. These can be prevented. So all seasonal diseases now we are seeing is they are preventable. So now we have tuberculosis, mosquito-borne diseases like malaria are coming down, fortunately. So other things are rising, but they are preventable. Right. You need government, individual action and community. All the three groups of society should work to prevent these mishaps happening. So that communicable disease can be prevented.
Sure.
Coming to the non-communicable disease, like we are seeing obesity in children, and we are seeing anemia, undernutrition, overnutrition. Both are there in non-communicable disease. They are not spreadable, but their people will suffer.
Right.
And your mental health issues, as we have discussed, that is also anxiety, stress, depression. We are seeing in adults and children also. So non-communicable diseases like obesity, early diabetes, early hypertension, early lipid disorders, all these can be prevented if you take healthy diet, if you start physical activity, if you keep your children engaged. Every child should spend 1 hour in playground. Every child should play 1 hour in the ground. So that will prevent gadget use. That will prevent your eye problems. That will prevent your mental health.
Absolutely.
So mental illnesses. So it will prevent obesity. If you sit at a place and play with the gadgets, busy with the gadgets, you will be obese. You are prone for disease. Your immunity will go down.
Right.
This is on one side. Other side, kids are people in 23.4 crores of Indians are poor in this country now. So they can't afford healthy diet. The parents can't afford. So their children will suffer. Their children are anemic. Their children will grow short. Their children will grow lean. They will put them at risk of poor learning. They will put the risk of infections. So these issues can be prevented. So these things we should prevent and help the society live healthier, eat healthier, and stay healthier.
Absolutely. So I'm surprised to know that mental health cases are on the rise even among children.
Yes,
at such a young age. Obesity, of course.
Yes.
And that malnourishment.
It's very sad. 50% of children, 50% of adults and girls, 50% of women in India are anemic. So anemia will impair your immunity, impair your learning, because these anemic children will not be able to focus. Their cognitive function will be less. Right. So they can't retain the subjects they were taught. They can't grasp the subject. They can't think creatively. They can't develop the skills which are needed by the industry. Their productivity, their earning will suffer. Right. So all these can be prevented.
So doctor, I want to ask you, do doctors in general make a good living? Do you think doctors make a good living?
Yes, reasonably good living, yes.
Right. And of course, medicine is considered a noble profession, but it has also become very lucrative today. We see a lot of doctors who make a very good living, and it has become very lucrative. There are so many opportunities. So I want to know, how does a doctor earn money? What are the different ways in which a doctor can earn money? Can you tell us that?
So, doctors can earn money through their consultations, through their visits to the hospitals where we see inpatients, where you take care of them through the support of the resident doctors there.
Right.
So, through writing articles to the newspaper, you make money. You write books, medical books, you get money. You go as a speaker to the conferences, you make money, you can make money.
Okay.
And myself, I have my own clinic. This is my own clinic. So I rent out my premises to a pharmacy who pays me monthly rental. I can earn if I rent out to another doctor if I have space.
Okay.
And if I lease out my space to a laboratory, diagnosis center, I can get money. Okay. So these are the avenues of, and a doctor is a citizen also. He can earn money from other sources also apart from your profession, my profession. I can invest in stocks, I can invest in mutual funds, I can invest in gold, I can invest in stocks, all these, real estate. But earning money shouldn't be the main reason to come into the profession. I want the youngsters to seriously keep this in mind. Go to a different field to earn money, but don't become a doctor or start your own practice to only the sole purpose of earning money. Right. Because it's a noble profession. Don't run after the money. Money will come. Patients will give you money. Right. If you are honest, if you are doing justice to the profession, you are honest to the people, honest to your profession, money will come.
So doctor, the next segment is called 10 on 10. So it's like a rapid fire. I'm going to ask you 10 questions and you have to answer without taking much time. So you have to give quick responses to all of these questions. Here goes, sir. The first question. If not pediatrics, which other specialty would you have chosen?
General surgery.
General surgery. All right. According to you, which country has the best healthcare system in the world?
UK.
Okay. If you had to use 3 words or expressions to describe India's healthcare system, what would they be?
Need, opportunities and challenges.
Need, opportunities and challenges. Okay. India is the best country to study medicine. Do you agree or disagree with this statement?
Yes, I agree.
Okay. If you could change or improve anything in the present healthcare system, what would it be?
The decision policy by the government which allows short-term medical training. Say they want to produce doctors, community doctors, by training them for a couple of years and make them doctors and hand over the responsibility of PhDs, which is not good. So to become a good doctor, you need minimum 7 to 10 years of experience. By training them for 3 years and handing over the responsibility of the community care to them is not good. That policy the government should do away with.
According to you, on a scale of 1 to 5, how well regulated do you think the following branches of medicine in India are? Let's start with allopathy.
4.
Ayurveda.
2.
Siddha medicine.
1.
Unani.
1.
And homeopathy.
1.
Okay. The one thing that today's medical community is desperately in need of.
Help from the society, help from the government in terms of medical community needs government support because government has to invest in healthcare.
Absolutely.
So public healthcare should improve so that all medical community will be the medical community's burden will be lessened.
The one practice or policy in medicine that needs to be done away with.
Policy in the medicine, government policy should change, as I said. So government should do away with these short-term medical training courses.
Right.
Those are not good. Okay. And the other policies, as we have discussed during our medical college, private medical college issue. So the stringent clause which prohibits the managements from lowering the fee. So those rules should be minimized so that the cost of the medical education will come down.
Sure. Okay. And mention any two common practices that parents of infants should never do, that you've seen in your practice, where some mistakes that parents make and that they should avoid
So
making.
formula feeding. So formula feeding is a big social, economic and health what you call hazards. Because formula feeding is unnecessary most of the times.
Okay.
It will burden the families financially. It will impair the health of the infants, newborns. Okay. So formula feeding, yes.
Can you explain what formula feeding is?
Formula feeding is top feed, your commercial level milk formulas.
Okay. That should be avoided.
Yes.
Okay. And any two practices that parents, especially of infants, they must do are?
Breastfeeding and vaccination.
Wonderful. Excellent, Dr. Raho. That was 10 on 10. You answered the questions pretty well.
That I could answer your 10 questions.
I want to know that for the medical community, for students who are starting out and who are now going to be doctors or doctors who started their practice, what is the future of medicine like? What should aspiring students or doctors focus on learning, or where should they put their attention? Where is it going to go? If you can talk a little bit about
So technology is going to play a major role in future, AI. So young doctors should be updated with the knowledge, how to use technology for the welfare of the society, how to provide best care to the society, to your patients. That they should learn and work as a team so that we can deliver better healthcare to the community.
Amazing. I think it was such an insightful conversation that I had with you. I've learned so much, and I'm sure the viewers, they've learned so much from everything that you've shared with us. Doctor, before we conclude, I want to ask you, what is next for Dr. Srikanth? What are your goals ahead? Do you have anything in mind? What you would like to do?
My goals are continuation of my good service to the society, directly, indirectly. Directly through my service to the pediatric community. And second is I also do a lot of social activities like training community with CPR training and awareness programs about anemia, non-communicable diseases, cancers. I am active in few NGOs. So as I am growing old and my children are becoming self-dependent, so I can spend more time to the community so that I can solve some problems of the society. That is my next probably step in my life.
Wonderful.
And I thank you for inviting me for your first show, and I wish you all the best, because people will know what a profession is, how challenging the professions are, how gratifying the professions are, what are the challenges, what are the opportunities. It's very good, and all the best. Definitely I'm sure that you'll be going to get huge success with this program.
Thank you, Doctor. Thank you so much.
Thank you, Abhi.